Hypokalemic periodic paralysis, HPP, is a rare condition where a person's blood potassium level drops suddenly, causing temporary muscle weakness or even total loss of movement. The episodes can last from minutes to a few hours, and then the muscles recover on their own. Think of it like a power cut that briefly turns off the lights in a house. The muscles work again once the electricity, potassium, returns. The main cause of HPP is a genetic mutation that affects how the muscles handle potassium. Most often it runs in families, autosomal dominant, and is passed from parent to child. Even with the mutation, an episode usually needs a trigger, such as eating a large carbohydrate-rich meal, like a big bowl of pasta, that pushes potassium into cells, resting right after strenuous exercise, stress, cold exposure, or certain medications. These triggers lower the potassium level in the blood, setting off the paralysis. During an attack, a person may notice sudden painless weakness that starts in the arms or legs and may spread. Inability to stand, walk, or lift objects, even though the person feels fine otherwise. The skin stays normal, no numbness or tingling. After the episode, strength returns completely, and the person may feel very tired. A simple way to picture this is, imagine you just finished a bike ride, eat a sugary snack, then sit down to rest. Moments later, you cannot lift your foot off the floor until the episode passes. Doctors diagnose HPP by measuring blood potassium when an attack is happening. It will be low, and by genetic testing for the known mutations. An electrocardiogram, ECG, may also show changes due to low potassium. Treatment focuses on quickly raising potassium. A doctor may give oral potassium tablets or an IV drip during an attack. Long-term, medicines such as carbonic anhydrase inhibitors, for example acetazolamide, can reduce the frequency of attacks. Patients are also taught to carry a potassium supplement and to act quickly when they sense a trigger. Prevention means avoiding the things that lower blood potassium. Practical steps include eating regular balanced meals with moderate carbs and enough potassium-rich foods: bananas, orange juice, potatoes. Keeping a food and symptom diary to spot personal triggers. Staying hydrated and not resting abruptly after intense exercise. Instead, cool down slowly. Using prescribed preventive medicines and checking potassium levels regularly. By treating the body like a garden, you give it the right nutrients and avoid droughts that cause the paralysis weeds to grow. Recent research has identified several new gene variants that cause HPP, expanding the genetic test panels. Small clinical trials are testing newer potassium-sparing drugs that have fewer side effects than acetazolamide. Scientists are also exploring gene editing techniques, like CRISPR, as a future way to correct the mutation directly, though this is still experimental. These advances bring hope for more precise diagnosis and treatments that could one day prevent episodes altogether.